We continue our lecture with STDs, or sexually transmitted diseases, or lately they've been called sexually transmitted infections, or STIs. Back in 1930s, clinicians believed that STDs would be eliminated by use of antibiotics. But today we know it never been happening, and the STDs are very common today, still very common, extremely common today. And usually, as you see on this diagram or this picture, usually they affect patients with multiple sex partners. So the question is, why STDs haven't been eradicated with the use of antibiotics? Because, first of all, we realize that STDs can be caused not just by bacteria, but by viruses and protozoa and fungi, and those are not sensitive to antibacterial drugs. Also, we found out that a lot of pathogens, a lot of bacteria, for example, Neisseria gonorrhea, become very resistant to antibiotics. Sexually transmitted diseases actually more dangerous for women and children, because, as you see, consequences of STDs are more severe for women and children. And the reason why, because most cases in women, STDs are asymptomatic. Women do not produce a lot of symptoms, and because those infections are not treated at the time infection usually goes further up, affects uterus, fallopian tubes, ovaries. As a result, patients might develop pelvic inflammatory disease. Of course, it leads to infertility, spontaneous abortions, and birth defects. And we start with gonorrhea, the first infection. Gonorrhea is caused by Neisseria gonorrhea, which is a gram-negative diplococcus. It grows on chocolate media at 5 to 10% of CO2. That means Neisseria gonorrhea is what we call microaerophilic bacterium, and it grows with reduced amount of oxygen. Neisseria gonorrhea has ampylae that it uses for attachment. Also, it can attach to sperm, and this way it can be carried into uterus and fallopian tubes and cause inflammation in those areas. Also, organism has ability to clump to each other. Bacteria can clump to each other, and this way they cannot be killed by phagocytes. Now, I already told you before that gonorrhea is not self-limiting infection, and the reason why, because Neisseria gonorrhea can mutate. It can change its surface antigen, and as soon as our immune system produced antibodies to those surface antigens, Neisseria gonorrhea changes, mutates, and produces new surface antigens, and that means our immune system has to make new antibodies to those new surface antigens, and then Neisseria gonorrhea mutates again. So that explains why Neisseria gonorrhea causes what we call not limiting infection. The source of infection is infected individual. Infection is transmitted through sexual contact or direct contact. As you see, males develop 80% of all symptoms, and those are painful urination and discharge. Most cases of gonorrhea in females are asymptomatic, and as I said, because it's not treated on time, infection has ability to go further up, and besides vagina, affect uterus, fallopian tubes, and ovaries. This is what we call a pelvic inflammatory disease. And the main symptoms of PID, or pelvic inflammatory disease, are fever, abdominal pain, bleeding, dysuria. Of course, it can lead to infertility. Gonorrhea can go systemic, and Neisseria gonorrhea, for example, when it gets into the bloodstream, can cause gonorrheal endocarditis, meningitis. Very common complication of this infection will be gonorrheal arthritis. Also, on one of our previous lectures, we talked about gonorrheal ophthalmia of newborns, or simply gonorrheal conjunctivitis of newborns. How do we diagnose this infection? We can use urine to test. So we can perform what we call DNA probes, or we can perform gram stain and then isolate that pathogen culture, identify it, and figure out sensitivity of that bacterium. On this slide on the left side, you see our discharge from the penis, and on the right side of the slide you see actually slide of Neisseria gonorrhea. This is how it looks like under microscope. And guys, this slide you're going to see on your lab final exam. As I said before, the large pink cells on this slide that you see, those are human white blood cells, and little tiny double dots, those are cells of Neisseria gonorrhea, which is gram-negative diplococcus. We continue talking about STDs, and the next infection is syphilis. Syphilis is a historical infection. It is caused by Treponema pallidum, which is a spirochete. It is a motile bacterium, and because it is a spirochete, there is no gram-stain reaction for this pathogen, because for spirochetes we use dark field microscopy technique. The source of infection will be infected individual. Infection is transmitted through the direct contact. And for your exam, you have to know 4 stages of syphilis. The first stage is called primary stage. Patients usually develop symptoms of primary stage of syphilis in 2-3 weeks after they've been infected. So what are the symptoms of primary syphilis? The very specific symptom of primary stage will be hard-based chancre. It is actually the entrance of the pathogen, and it can be seen in the mucous membranes of penis, or vagina, or cervix of the uterus. If you look closer at that surface of that lesion, you will be able to see infectious exudate on the surface. And if you culture that exudate, a lot of Treponema pallidum cells will be found. You have to remember that this lesion is not painful at all, and we call it a hard-based chancre because if you touch that lesion, it actually feels exactly like a cartilage of the ear. Also, local lymph nodes in the groin area usually are enlarged. If this stage is not treated, then patients develop secondary syphilis. During this secondary syphilis, Treponema pallidum gets into the bloodstream, and that means infection becomes systemic. Symptoms of secondary syphilis are skin rash, loss of hair, and this is a result of the damage of the blood vessels, malaise, low-grade fever. The lymph nodes in different areas will be enlarged. And once again, if secondary syphilis is not treated, then patients develop what we call latent syphilis or latent period, or latent stage of syphilis. Latent syphilis can actually last for years. We call it latent stage because no symptoms will be produced by those patients, but keep in mind those patients are still source of infection. They're contagious. And if the first 3 stages of syphilis are not treated, then patients develop what we call tertiary syphilis. Please remember, tertiary syphilis is a deadly stage of syphilis. That means on the primary stage, secondary stage, and latent stage, syphilis can be treated, can be cured. But if patient already developed tertiary syphilis, tertiary phase, that means patient is in a deadly form of syphilis. Why? Because the immune system of those patients will be destroyed. When the immune system is badly irritated, it starts forming granulomas. We call them gammas. Those are rubbery masses, and they can replace normal tissue in any system. And usually, eventually, those patients die when life-threatening lesions are formed in vital organs, for example, cardiovascular system, nervous system. There is another form of syphilis, we call it congenital or prenatal syphilis. You have to remember that Treponema pallidum has the ability to cross placenta. And usually if a woman is pregnant, if that pregnancy doesn't end up with abortion, spontaneous abortion, then the child will be born with congenital syphilis. And the main characteristics of congenital syphilis will be, of course, birth defects, defects of teeth, bones. Also, those children will develop deafness. To diagnose syphilis, we can culture the serous exudate from the surface of the canker and then isolate, identify pathogen, or we can use ELISA test. Means we look for presence of antibodies in the patient's system to Treponema pallidum. For the treatment, we use antibiotics. For example, penicillin can be a drug of choice. On this slide, there are three pictures. On the top picture, you see a picture of heart-based canker. On the left, lower left picture, you see a rash of secondary syphilis, and the bottom right picture, you see gammas. Those are rubbery masses, and in this case, they replaced healthy skin. Next bacterium that can cause STDs is Chlamydia trachomatis. There's no Gram-Stein reaction for Chlamydia trachomatis because all chlamydias are intracellular pathogens. Chlamydial STDs are actually co-infections of Neisseria gonorrhea infections, and that means every time when you have patient with gonorrhea, if you check that patient for presence of chlamydial infection caused by Chlamydia trachomatis, result almost always is positive. By itself, chlamydial STD is very difficult to diagnose. Why? Because this infection doesn't produce too many symptoms. If it does produce symptoms, those are going to be mild dysuria, small amount of mucoid discharge from urethra or vagina. That's why this infection is so difficult to diagnose by itself. But does it mean that it is not dangerous? No, it is actually can be a very serious infection because same as gonorrhea, it can go further up, and especially in females, affect uterus, fallopian tubes, ovaries, and of course it can lead to infertility or spontaneous abortions. Same as Neisseria gonorrhea, it can cause eye infections of newborns, and we call it chlamydial conjunctivitis of newborns. For the treatment, we use antibiotics. For example, erythromycin, doxycycline. Next group, other STDs. Besides Neisseria gonorrhea and Chlamydia trachomatis, STDs also can be caused by other pathogens. For example, Haemophilus ducreyi can cause what we call cancroid. It is a common infection in tropical areas, in Africa, for example, Asia, Latin America. But it becomes more and more popular, more common in the United States, and this infection is very common among drug addicts. People usually get infected through the mucous membranes or lesions in the skin, and the main symptom of this infection will be soft canker. Unlike a heart-based canker and syphilis, soft canker in cancroid is a painful lesion. Infection is self-limiting. It means if you do not treat those patients with antibiotics, they will recover. But if you prescribe antibiotics, it will speed up recovery and also will prevent scarring to the areas on the genitals that are affected. So, for example, we can use cephalotriazone for treatment of this infection. Next group, this is what we call non-gonococcal urethritis. Those are STDs that can be caused by, for example, Uroplasma urolithicum and Mycoplasma hominis. A lot of those STDs do not produce any symptoms, can affect women and men, and usually those STDs affect people with multiple sex partners. And once again, because they do not produce too many symptoms and a lot of cases are asymptomatic, that inflammation with that pathogen can go further up, affect prostate gland in male patients, or uterus, fallopian tubes, and ovaries in females, and can cause actually infertility, ectopic pregnancies, and spontaneous abortions. We continue with viral STDs, and the first virus we're going to talk about is herpes simplex virus. As you remember from previous lectures, herpes simplex virus can cause acute and latent infections. It means after a patient recovers from this infection, virus doesn't go anywhere. It sits in spinal nerve ganglia, and every time when it's reactivated, patients develop symptoms of infection again. As you see on the bottom of this slide, it says condom provides some protection. Scientists believe that actually viruses are so small they can go across the condom, and as a result, condoms do not protect humans against viral STDs. As you remember, you have to know two types of herpes simplex virus, type 1 and type 2. And I told you herpes simplex virus type 1 usually affects humans above waistline, and herpes simplex virus type 2 usually infects humans below waistline. Since we're going to talk about herpes, genital herpes today, that means we're going to focus on herpes simplex virus type 2. So the source of infection will be infected individual. Infection is transmitted through direct sexual contact, and initial infection symptoms will be fever, headache, muscle aches, means symptoms of intoxication, and then rash on the surface of the mucous membranes of genitals. Rash is extremely painful, and of course on this stage patients are very contagious. And then, as I said, because herpes simplex virus belongs to herpes family, after patient recovers, that virus doesn't go anywhere. It stays in the spinal nerve ganglia, and every time when it gets reactivated, patients develop symptoms of genital herpes again. There's another form of herpetic infection that can be caused by herpes simplex virus. It is what we call neonatal herpes. It is a life-threatening infection that affects newborns. And in this case, infection goes systemic. It spreads into the bloodstream, into the brain, affects internal organs. And usually, if those babies don't die, they actually become disabled to the rest of their lives. For the treatment of this infection, we can use acyclovir. As I said before, this drug, acyclovir, we use only for treatment of herpetic infection in adults. And on this slide, you see a picture of neonatal herpes in a child, in a small child. The next virus is HPV, or human papillomavirus. It causes what we call genital warts. STD is transmitted through the direct sexual contact. There are more than 65 different kinds of human papillomavirus we know today, and I already talked about the fact that three strains can cause cervical cancer in women. By genital warts, it is actually STD, but it is not life-threatening, usually local infection. The lesions, wart-like lesions, usually appear on the skin or mucous membranes of penis, vulva, cervix. It is a not life-threatening infection, but not very good-looking infection. There's no cure for this viral infection, but we can actually treat that infection by removing those lesions using liquid nitrogen. But of course, it is not a cure of that infection because those lesions might appear in somewhere else.